My name is Jackie Nudd. I got involved with UASC initially in 2010 when a centre was opened by Social Services, and we were asked to offer primary care services. You'll be dealing with common conditions such as asthma, diabetes, epilepsy, and another thing, there's a lot of common symptoms that they will present with, and that's things like stomachache, headache, backache, sleep issues, nightmares, eating problems, and this is all linked to not eating and sleeping properly. You have to think outside the box all of the time. They're a completely different cohort in many ways to the normal practice population, but they're just normal young children and adolescents with exactly the same issues that any other child would have of that age. Primary care is absolutely crucial in looking after them because they cannot access any health services in this country without an NHS number. And the only way you can get an NHS number is by registering with a general practitioner. And primary care is the first port of call for most signs and symptoms and common diseases, but it opens doors to other services as well. Sometimes they won't always be totally honest, and they may hide things from you because they don't know what the repercussions of that will be, and they're not sure of who to tell what to. We had a couple of children were diagnosed with epilepsy but didn't want this labelled and were in denial because of issues in their old culture as being deemed possessed by demons, which made it very, very difficult when actually there is a clinical need for them to be investigated and treated. So you have to think more than what you might see as common in the UK population. Think about where these young people have travelled from, where they might have been and what they might have been exposed to. So think about things like malaria, and with those coming from the African nations, whether they could have bilharzia or schistosomiasis, which are not things we would normally think of in general practice. And their attitude sometimes, particularly to women because of cultural beliefs back home, can be difficult. So we used to have to talk to them and they'd be taught about British culture, respect, how to treat women. And likewise, some members of staff's attitude and behaviour, they needed to be reminded about what had happened to these young people. So that it was a two-way thing about attitudes between both staff and the young person. I think the first thing is to have patience, to actually give them time, which is really difficult in primary care because we're all under so much pressure. But think about when there's a quieter time in the practice, maybe an early afternoon slot isn't as rushed, to give them time to prepare for the visit, to find out what their language is and if available, download information for what you're seeing them about. Find out if they're coming with an interpreter. And if you're doing anything with them and somebody asks for information, be careful of who you share what with and make sure you have signed informed consent before releasing that information. I think I've thought more about how things look from their perspective, because sometimes you have to think beyond the actions that you're seeing in front of you. There are reasons why they're behaving the way they are, and to not be critical and pass judgment to find out why. It's been very rewarding work, and to see how some of the young people have blossomed with the help and support when they might have had months of unknown, and to actually feel a little bit more secure and know that there are people there that genuinely do want to help them. Yeah, it's been very, very rewarding work,